Welcome to the What's Happening Birmingham video podcast.
This podcast is brought to you by the Jefferson County Department of Health.
Hello, everyone. This is Jarvis S. Scott with What's Happening Birmingham. Back again with Dr. Kre Johnson. This is my second segment. Thank you, Doctor. This is going to be a fun segment right here that everyone can relate to. So the reason why I wanted to make this the second segment, and I know everybody will definitely tune in from beginning to end on this, we're going to talk about a common topic in the majority, I want to say, Americans that they deal with. And I also want to go a little deeper in the majority of people that look like me and her right now. It is blood pressure, which they call hypertension. So want to bring the doctor on and get your thoughts on it. So what's the medical definition of blood pressure and hypertension? First off, when you start off.
Okay, so hypertension is described of at least two elevated blood pressure readings that have been recorded in two different settings, right? So you come to the doctor on a Monday and your blood pressure is greater than 140 on the top or greater than 90 on the bottom. You meet the criteria for having hypertension. So Jarvis, before you say anything, all the people that's watching will say, oh, it's my blood pressure. It's never high unless I go to the doctor. So my words to that person is, well, bring me the proof. Start checking your blood pressure at home. Show your doctor, show your clinician that your blood pressure looks good at home. Because I'm like, well, when else are you checking it? If it's only had the doctor, but you're only checking it at the doctor, build your own case. Build your case that I know I've been here 2 times. My blood pressure was up, but here are my readings. Bring your blood pressure cuff with you so the doctor can calibrate your machine. So we'll check your machine against our machine to make sure that the numbers are the same or similar. And so therefore we can say, you know what, you're right. It's only high here. And it is good when you're at home. You don't have high blood pressure. You have what's called white coat syndrome.
Okay, so, and we'll go back to, what was, like you said, the top number and the bottom number? Break that down.
The top number is a systolic number. That is the beating, how hard our heart is beating. That number is greater than 140. The diastolic, or the bottom number, is the feeling of the heart, and it is greater than 90. So if you have greater than 140 on the top and or greater than 90 on the bottom on more than 2 occasions in two different settings, then you meet the criteria for what we call hypertension or high blood pressure.
Okay, and let's walk through it. Okay, I come in, I see you. It's determined I got high blood pressure. Okay. What are the next steps from there? And kind of break the differences between the medication versus living a healthy lifestyle.
Yes, okay, that's right. So the first thing we would do is say, okay, you have the diagnosis of hypertension. We need to look at what we're doing as far as how much salt are you eating? How are we eating a heavy salt diet? Are you eating a lot of canned goods? Are you eating a lot of frozen foods? Start looking at the salt. Are you eating out a lot? Those are ways that you're probably likely getting a lot of salt and you don't even realize it. So even if you're eating at Subway every single day, you're probably still getting a lot of sodium. Are you drinking a lot of drinks? So we look at the first defense against hypertension is lifestyle. We want to make as many lifestyle modifications as we can, limiting our salt, increasing our water intake, and exercising. So when I say exercise, I mean at least doing 30 minutes 4 to 5 times a week. So you need to really be getting your heart rate up, really feeling it burn, not just, I walked a lot at work today. So, that kind of counts. If your heart rate is not getting up and you're not feeling like you've had some kind of cardio, then it's a good chance that you're not going to be able to burn any calories. So the first step, Jarvis, is we say, let's start some lifestyle modifications, get you a blood pressure cuff at home, start checking your blood pressure a couple of times a week, and record it. So I want to see the blood pressure log. I want to see what it's looking like at home when you're as least stressed as possible. in the morning. You can check some in the middle of the day during your high stress time, so we can see what your blood pressure is looking like, and we can see what it's looking like before bedtime. So keep that log and start doing lifestyle modifications. That's the first step after you've been diagnosed with hypertension.
Okay, let's talk about the blood pressure pills.
The pills, right?
Yeah.
So the pills, you come in the next time, you bring me a log, and your numbers are still 150s, 160s, 145, over 90s, 100s. We're like, okay. And you have your diet log too. You're like, I knew you were going to ask Dr. Kre, so I showed you. I wanted you to know what I was eating. See, I've been drinking 8 glasses of water. I've been on this 1,500 calorie diet. I'm exercising, and I even lost weight. So did you know that family history makes up a huge component of our hypertensive diagnosis? I had high blood pressure after having my baby. Nothing about me, I'm normal weight, I'm small, all of this. And my family history is full of high blood pressure. I had a baby, I had high blood pressure after that. I had pre-diabetes, all because of my family history. So you can't just look at someone and say, oh, they big, they fat, they overweight, they this, they should have high blood pressure. I didn't look like I should have had any of that, but I did. So family history is something that's very hard to break, because all of that stuff is kind of passed down from generations to generations. So I kind of got off. Okay, so let's talk about the pills. So you bring me all your stuff, and I'm like, okay, I know you tried to do it over these last few weeks by yourself, but it's not working. So depending on the race, for African Americans, we have a certain set of medicines that work best for African Americans than they do Caucasians. So if you're on lisinopril, enalapril, benazepril, anything with the pril, and you're African American, watch yourself for coughing. If you can have a cough to develop from the medicine, your lips can swell from the medicine, your tongue can swell. It is one of those medicines that you really have to be watched on. Or you may say, hey, is there an alternative that I can be on because of the side effects that African Americans can have from that class of medicines? And also, men, lisinopril, benazepril, it will mess with your sexual function. So that may not be a medicine that you want to start off on, just because you don't want there to be a side effect anyway.
Yeah, because like you can start off with the small one, 5 mg.
Yeah, 5 milligrams.
I got one called, gosh, what's the name of it? And some type of part of it.
Amlodipine?
Huh?
Is it amlodipine?
I think it is. Yeah.
And that's a great medicine for African Americans. It's the class that's kind of the go-to class of medicines that I go to for when I have somebody that's new. It's a 5 milligram pill. It starts off at 2.5, 5, or 10. And watch your body, because the middle of the road dose may be fine, but if you up to 10 milligrams, you may have some swelling in your feet. So when you start these medicines, any little thing, write the side effects down and go to your doctor, y'all, with a note. Because I know when I start talking, I'm like, Travis, how your mom and them doing? How your cousin doing? Oh, show me the pictures. And then we look up, we done ran our mouth for 30 minutes. And then you're like, well, what was I supposed to come? I was supposed to be telling you something. So write all this stuff down. My side effects were this. My blood pressure readings were this. And then when Dr. Kre walks in that door, just hand me the note. Because that's that guy's like, oh, okay, so this is going on, that's going on. So make sure that you watch the side effects of your medicines. I'm not saying go out there and read all of those words that the pharmacy gives you. But if you start taking a new medication and something's different, okay, this is giving me a headache. This is giving me swelling in my feet. This is making me cough. These are things that you need to be bringing to the attention of your physician so they can either change the dosage or change the medication altogether.
Now, I like how you went back earlier, you was talking about men, I guess, the sexual function. How does blood pressure medicines interfere with that? Like
how can it affect it? So one thing's for sure, if you have uncontrolled high blood pressure, Jarvis, for years, I have lots of men, oh, it's not my blood pressure fine, I'm not taking any medicine. Okay, the longer that you have uncontrolled high blood pressure, it affects your vessels. So your veins, your arteries, and your veins and arteries go everywhere. even to your man parts. So that is being overworked. Everything is being overworked, and because your blood pressure is super high. So after a while, if you keep running a marathon, your everything gets tired. And so you're like, man, my directions aren't the same. They aren't as strong because your body is super tired. So then once you add into that medication, who is trying to keep the blood flow as best as it can, we're trying to keep our heart from working too hard. So now you really got this double whammy in because you did not take medicine for 5 years, 10 years, the doctor was telling you. So all of that is starting to not function as well as it did initially. On top of, as some side effects of the medicine is to make your libido less or to make your erections less because it may be having your blood flow go other places. So it is a hard thing because high blood pressure induced erectile dysfunction is a very common issue that a lot of men have. And it could be negated if they just had started taking the blood pressure medicine earlier. So be mindful, men, if you're out there and you're struggling with the diagnosis and you don't want to take the medicine, you do want to have great erections until you die, right? So you need to get on that blood pressure. Get on your blood pressure medicine.
Now, do you combine the ED pills and the blood pressure pills together though?
So yes, you can. You can now. So that's a good conversation to have. What we don't combine is you don't take your Viagra, your Cialis with nitroglycerin. So if you got heart problems, have had a heart attack, those can make your blood pressure drop really fast. However, if you're on high blood pressure medicines and does not have any nitroglycerin in it, talk to your primary care doctor, talk to your cardiologist, and make sure that it's okay. But oftentimes, as long as they're not on that class of medicine, they can take the medicine and be able to have an enjoyable sex life. If they waited to the last minute to get on blood pressure medicine. And like I said, your vessels are very sensitive. We want to keep our blood flow going everywhere to our legs. You don't want the swelling in your legs, so it's not just to your genitals, it's to everywhere. So after a while, your heart is doing all of this beating, it's beating, and it gets tired because you've overworked it because you did not protect your heart. You didn't protect your kidneys. That's why we have so many African Americans on dialysis. It's because of uncontrolled, untreated high blood pressure oftentimes.
Okay, I want to talk about, and I want to get your medical opinion on foods. Is there any foods that can lower blood pressure? And also for these people that like to go to these quote unquote, I like to call it holistic stores, and they think they take the stuff to lower black seed oil or whatever they call it.
So you can look at foods that are high in like magnesium. So you can do your nuts, but make sure that you don't overdo whatever you're going to do. Because nuts, they may be a good source of your magnesium. However, if you eat 25 of them, you might have just ate 1,000 calories because nuts are high in calories. You can eat omega-3 rich foods like salmon, not salmon out the can, but like pink salmon, a fish. So high in fish diets, that can help. And if you are going a holistic route, magnesium, like I said, a magnesium supplement is good. Omega-3 supplements are good. But the big thing is don't be so set to just be holistic and say, I'm not going to do what the doctor says to do. The black seed is good. All of that is great, but marry them. It's okay for conventional and holistic medicine to work together. So you can do your supplements. Hey, be taking that amlodipine as well, because we want to live a healthy, happy, whole life for as long as we can.
I want to get this question into you before I go to the next thing. So what's your history of being career being a doctor, what's the youngest age you've seen somebody with high blood pressure?
The youngest age I've seen is 5 years old. Okay. So everybody thinks of high blood pressure as being totally just related to your diet, exercise, family history. However, your blood pressure can be related to your kidneys. Blood pressure originates in the kidneys. We have a whole system where we, get rid of our salt, we absorb our water, we get rid of our water. And if you have one kidney and something's wrong with that kidney can be working overtime and cause you to have high blood pressure. But the kid actually grew out of it and was able to come off of the medicine. But you can have it. So that means you need to be taking your kids to the doctor as well. Taking your kids, and they check their blood pressure when they go. And then after that, maybe like a 16-year-old, but that 16-year-old was overweight, 200 and something pounds, eating out all the time. So making sure that we look at our blood pressure, but we also are watching our kids and making sure, because drivers after a certain point look like we went to the doctor a bunch. And then in my childhood, I don't remember going to the doctor. I just don't remember going. So I think once a year, still making that appointment, whether your kid needs shots or not, so that they can be weighed, so that their blood pressure can be checked. Because you never know what's going on with all the processed foods that we're eating nowadays, all the salt and all the fast foods. Get your kids' blood pressure checked as well.
So it's a good idea to just get rid of frozen foods altogether.
No, not necessarily. Read the backs of the containers. I'm not saying there's a place for them. Read the backs of the container. Look at the sodium amount. Watch your sodium amount. Some of the things you look and it's like, man, it's 1,000, grams of sodium. Yeah, put that one back. Look for the low salt, the low calorie, and go from there.
Now, I'll be remiss not to talk about this alcohol.
Yeah, that's a big one.
Yeah,
that is a big one. Yeah. So a lot of alcohol has lots and lots of salt in it. Okay. Beer, especially. Beer is full of salt. Wine is full of salt. Just alcohol in general. So you have to be mindful of, you hear the recommendation. You can have like a glass of wine, maybe 2 a night. We're trying to be real generous here. But be mindful that you may start to feel a little puffiness in your hands. Your feet may kind of puff. Your weight may kind of go up. But you would definitely have water retention, which now, since we're retaining water, that's going to cause your blood pressure to go up. I have people that I can tell that they are drinking more by their blood pressure. I'm like, what are you doing? Okay, I'm taking all my medicine. You can't be taking your medicine. Yes, I am. Well, how much you drinking? Well, I drank this morning on my way in here. Yeah, baby, that's why that is why your blood pressure is up.
Can you tell
so alcohol? Say it again.
I apologize. Let me interrupt the thought in my head. Can you tell your eyes sometimes you've been drinking too much that you can just...
your eyes can be red. The eyes can even be yellow a little bit, because if it's aggravating your liver, that shows as well. Like, you can lie to your doctor, but your labs never lie. Like, I can look and say, oh man, how much you drinking? Oh, I'm not. No, ma'am. Your labs say that you are drinking. So tell me how much you're drinking. That's why you got to have a doctor you trust, Jarvis. I want my people to be able to come in there and tell me whatever it is that they're doing, no matter how outlandish they feel, and they feel that it's a no judgment, zone or whatever. So yes, but alcohol for sure will cause you to be on 3, 4, 5 blood pressure medicines, and you're like, I can't get my blood pressure down. If you backed off on your alcohol, that would decrease the amount of unnecessary salt and just empty calories that you're getting in, and that will help your blood pressure to come down.
Now, 2 more questions I got. Can hypertension, can it be cured? Have you seen cases where people have gotten totally off the blood pressure?
Yes, I have seen people come off of their blood pressure medicines, and then we go back to the fact of, what is our lifestyle? They come off their medicine, and then you look up and they're like, well, I haven't been eating right. I started gaining my weight back. A lot of it can be fixed with weight loss, losing the weight, watching your calories, watching your salt intake. However, that does not mean come off your medicines and stop going to the doctor. Stop monitoring your blood pressure. You know how we are. We're out of sight, out of mind. They said I was healed. They said I was done with that. I'm done with it. No. Still, if you come off your medicine, check your blood pressure occasionally at home. Go to your doctor still at least once, twice a year, so you're confirmed. And then we still need to get your blood work done, because we still need to get your kidneys checked, because blood pressure originates in the kidneys. I want to see what your kidney number is looking like. because that's going to tell me the truth of what's happening when you're not with me for that 15, 20, 30 minute, segment that we're together. So I have pulled people off of their blood pressure medicine, but I have had to put some of them back on their medicine because I'm not one that, here it is, this is what you got, and you got to have it forever. I want you to prove to me that you can stay off of it. So if you want to mind and we're coming off of medicine, it's going to be some work to show that, because that way, if you see that it's starting to creep up, you can say, all right, Dr. Kre, I need to go back on my medicine, or I need at least a little low dose. So we have to have some, you have to have some accountability in that. A lot of things we just throw off on the provider, the physician, where they'll watch it when we go, no. I need you to be mindful so that hey, it's getting too low. Maybe I need to come off of some of my medicines, or it never goes down. I need another medicine. That's okay as well.
So what number should a person look at as far as, like you said, below? What I'm gonna go extreme on this. I'm gonna say extreme, but it's gonna be extreme. What number, if you're taking a reading at home, like I need to go to the emergency room, I feel like I'm about to have a heart attack?
So it's because it's too high.
Yeah, if it's too high.
You're saying, okay. So if your blood pressure is over 160 and it's over 100 and you have symptoms, that be you seeing spots, you have blurred vision, you have chest pain, you're sweating, something is going on. But because I say with symptoms, Jarvis, because a lot of people walk around living at blood pressures at 160, over 90, over 100, that's their normal because their body's thermostat has reset itself. So if you having that high blood pressure and you have some symptoms, I got chest pain, I'm short of breath, my eyes hurt, my head hurt, I got this pounding headache, I can't go, you may need to call your doctor and see if you need to come in quicker, or is this, hey, I got chest pain, I need to get to the ER. But usually it's not just a high number, but it's what else is going on with you. Because I have high blood pressure is a silent killer. I'm like, your blood pressure is 170 over 110. It can't be that high. I feel fine. So that's the scary part of it. So if it's that high, your body just adjusts and say, oh, this is where we live. 120 over 80. If we get that low, we might faint because your body's not used to being there, but it is used to being at 170 over 100 and it's happy there. So you have to know what symptoms go along with that number. What does a patient look like? What is going on with you when you see that reading before just saying that number is high, go to the ER. So the number may be high. Oh, go ahead.
Oh no, I'm probably, and what I mean, she say silent kill, she mean heart attack, everybody.
It could be a stroke, Jarvis, a heart attack or a stroke. You can have an aneurysm. So it's several different things. So or cause you to have kidney failure, end up on dialysis, and so it can be the underlying is going on for so long, and it's causing you to have other kidney organ damage, kidney damage, brain damage now from stroke, heart damage from heart attacks. So it goes on and you don't even know it. Like, oh my gosh, it was that high. I felt fine. You feel fine till one day you don't.
Okay. So if people want to reach out to you, they want you to come by and check their blood pressure, what's that phone number and website?
The phone number at Brown, my clinic is Brownstone Healthcare. We are 205-202-5650. And the website is www.brownstonehealthcare.com. Thank you.
Okay. And gosh, there's something else I was going to tell you. Any last thoughts you want to add? I know we covered a lot.
I think that it's important to find a primary care doctor and stick with them. Find somebody that you enjoy, that you look forward to seeing. Most people are so nervous to go to the doctor that, they're like, I don't even know the name of my primary. You need to know your name of your primary. So find somebody you like, you enjoy going to see, and that you're not afraid to be as open and honest with as you can be. So, and that's it.
All right. Well, thank you, Dr. Kre, for 2 segments. I think I got 2 minutes where I'm good. But fellas, ladies, don't be afraid. Please check your blood pressure. I gotta check my blood pressure now. It's just one of the things to get over. Just live with it.
Exactly.
Be thankful because, like you said, this thing's a silent killer. You'll be here one day and we live in this age of COVID. 2 days later, you're gone. And COVID can also lead to that too, but we ain't gonna get into that. That's a whole other subject. But thank you all for watching this video. Please check out what'shappenedbirmingham.com for more videos. And don't forget to subscribe to my YouTube channel. Thank you all again. Have a great day. Bye-bye. Thank you, Dr. Kre.
Bye.
Thank you for watching the What's Happening Birmingham video podcast. Please check out our website, app, or subscribe to our YouTube channel for the latest videos today.